thank you for the introduction, Rachel, and thanks for the invitation, Professor Lee. So, as Rachel said, I'm Chunxiao Hu. I'm a lecturer in Biomedical Engineering from University of Glasgow. So, today I'm going to talk about a technology I have developed together with Professor David Cumming here at University of Glasgow. It's called Multicorder. So, enabling the future of point-of-care diagnostics and screening. So a little bit about myself. I did my bachelor degree back in China at Hohai University. So by the time the major was automation, it has nothing to do with biosensors and blood. But when I moved to the UK to do my master's and PhD at University of Southampton, that's where I got introduced to the field in microsystem technology. And also for my PhD, I have developed several microfluidic devices for various applications. And that's where I moved my interest to developing biosensors, especially in miniaturized technologies. And in 2016, I moved to University of Glasgow to work with Professor David Cumming. So the research here in Glasgow focused on developing point-of-care diagnostic devices for early diagnosis and screening tests. And the multicorder is one of the major technology we have developed here. So here's the outline for today's presentation. So first, I'll introduce what is the multicorder technology and the CMOS chip and the sensor types involved in this technology, and how we implement the different ways for multiplexing. One is the dual sensor mode, and one is microfluidic channels. After that, I will talk about some of the applications we have done so far. There will be two examples. One is on prostate cancer, and one is for bleeding disorders. Then I will end with a conclusion. So first, the multicorder technology. So the reason it's called multicorder, it was inspired by the tricorder from the Star Trek. You can see. So the reason we call it multicorder because we are trying to detect or measure multiple biosensors for various applications with the single device. So the core technology here is the CMOS chip. You can see here. It's quite small, around 3 mm by 3 mm size. So this embedded CMOS chip with an array of optical and ion-sensitive sensors can be used for simultaneous measurement of different types of biomarkers, sorry. For example, metabolites and proteins. And we have tried different human samples as well. For example, blood, human serum, human plasma, and the urine samples. And also, at the bottom, that's the current setup. So it's a handheld device with a chip carrier and the PCB boards. It can be connected to a mobile device, such as a tablet or mobile phone. Then you can do simultaneous measurement with a chip there. You can get your result from your tablet. And on the right-hand side, so that's a future product we are aiming for. So we're trying to get this possible cartridge, so which contains the samples, reagent, and the CMOS chip, and also a reader underneath with all the addressing, digitalization, and the transmission functions, and also with data analyzed on a mobile phone or a tablet. So that's a future product. We're trying to build a point-of-care diagnostic device with this multicorder technology. So here is the connectivity diagram of the multicorder platform. So as I just mentioned, the CMOS chip is the core technology. So it has been wire bonded to a ceramic package, which is commercially available, and it will be mounted onto a PCB with microcontrollers for addressing and all the other functions. And it can be connected using a USB cable to a mobile device or a laptop with GUI developed by ourselves. And that's the connectivity diagram. And here is the diagram shows the multicorder setup. That's what we use in the lab to do the measurement. So there's a stand with the LED as a light source and with a lens to generate collimated light shining onto the CMOS chip on the cartridge and the readers. These setups is to demonstrate for use of the photodiode sensor, because we have different types of sensors, but the photodiode is the most used one. That's why we show the setup this way. I'm going to talk about more details about the different sensor types later here. So that's the CMOS chip. So A just shows how it looks like. As I said, it's 3mm by 3mm, and it's an array of 16 by 16, which can give you in total 256 single pixels in this single chip. So in each of the single pixels, actually there are 3 types of different biosensors. So the first one is photodiode, which is a optical sensor. Another one is called ISFET, ion-sensitive field effect transistor, which is electrochemical sensor, which basically detects a pH change. And another one is called single photon avalanche diode, so which is another type of optical sensors. So currently we mainly focus on the first 2 sensors at the moment, but the SPET has been proved to be useful as well. So at the bottom here is the schematic representation of the multi-sense elements. So that's how we fabricate 3 sensors in a single pixel. So that's not in scale, but just gives you a general idea how they are made. They are made from the foundry as well. So as I just mentioned, we mainly use these 2 types of sensors. One is called ISFET, another is photodiode. So the ISFET is basically detecting pH changes. So from the reaction, if it produces hydrogens, which can be detected with the ISFET sensors during the chemical reactions. And another type we use is called photodiode, or PD. So it records the light intensity transmitted through the reaction solutions, so which has a color change due to a reaction. So the light transmits through the light source onto the sensor surface. If the color changes, a certain light intensity will be absorbed. So that's how we detect the concentration change from the reactions in this case. So since we have different types of biosensors, and we also have like in total 256 pixels on the sensor, that's how we are going to do multiple measurement with a single chip. So here are 2 ways actually to achieve multiplexing with this multicorder platform. So the first one is called dual sensor mode. So here we use 2 different types of sensors. We use ISFET and photodiode at the same time for multiple measurements. So here you can see here is a reference electrode that has been used for pH sensing with the ISFET, and here is the LED, which has been used as a light source for the photodiode. And it depends on the applications. We have also put a flexible heater underneath to produce a temperature control, because for some of the enzymatic reactions and chemical reactions, it requires 37 degrees, and you use PID controllers to control the temperature. So that's how we use the different types of our sensors for multiplexing. So another one is using microfluidic structures. We have generated microfluidic channels on top of the sensors, so which can provide a physical separation of the experiment. Currently, we are doing 4 microfluidic channels on top, so which means we can do 4 different measurement at the same time with this setup. First, I'll talk about the dual mode sensors. So here's the picture shows how it works. As I said, there's a reference electrode for ISFET and LED for the photodiode. So all the reactions will be happening in a single well. So that's where the reaction happening on the sensing areas of the CMOS chip. So the single well will contain all the required reagent for all the experiment. everything will be functionalized on the surface. For the actual measurement, you add your analyte, add your sample, for example, your blood sample or plasma or human serum. You add the samples into the well, the reaction will be happening. So in this case, it's going to generate protons, hydrogen ions, and also generate color changes. So both reactions can be detected simultaneously in a single well by both ISFET and the photodiode. Here, just one example. So we have demonstrated how to use both type of sensors at the same time by detecting glucose and cholesterol. So the reason we choose those two metabolites because they are highly related to CVD diseases. And I'm not going into details because it's a well-known disease, and glucose and cholesterol are very important biomarkers. So we designed the two different assays for glucose and cholesterol. So for glucose, if they react with hexokinase, it's going to produce hydrogen ions, which can be detected by the ISFET. And for the cholesterol, by using cholesterol oxidase, it's going to produce hydrogen peroxide here. And the hydrogen peroxide can oxidize this colorimetric agent called odanocytin, which can gives you a color change with the presence of peroxidase. So that's how we use this assay to check the performance of the photodiode. So we have successfully detected both metabolites by using the ISFET and photodiode at the same time in a single serum sample. Here is a result from a single pixel. As I mentioned, there are in total 256 pixels. We can actually address single pixels individually, so which can gives you 256 result from a single measurement as well. So the good thing about array is we can average the result afterwards to give you a more stable result and give you a higher signal to noise ratio from the averaging. And even from a single pixel here, you can see that's one example. It can give you a good resolution and enough information for the detection. So here's one example from a high concentration of human serum with glucose and cholesterol. So the orange curves gives you a result of the cholesterol from the photodiode, and the blue curves gives you a result from the glucose measurement from the ISFET. So you can see the red dashed line shows where we add the analyte, which is the serum in this case. So then you can see the reaction happened immediately afterwards. Then you can get both results simultaneously. And here are some statistics. So we have tried different concentrations, and that gives a good result for different concentrations within the physiological range. So for the glucose, it produces protons accordingly to the glucose concentrations. And for the cholesterol, it gives you different light intensities, which can be detected by the photodiode. And the good thing about this multiplexing approach is you don't need to separate the samples. You can detect both metabolites from a single sample, which can give you more controlled result because it's the same sample from the patient. And another way is microfluidic channels. We have fabricated microfluidic channels on the sensor surface. So the physical separation allows to perform multiple assays at the same time. And again, in a single microfluidic channels, there are multiple sensor types. Here we just show photodiode because the most of the experiment we have been doing is by using photodiode, but there's also ISFET here as well. If you want to do multiple measurement with different types of sensors, that can be achieved as well. But here we just show photodiode for example. So you put different microfluidic channels separated by different material, for example, epoxy in this case, or PDMS, different types of polymer materials. So to achieve a physical separation on top, So the good thing about microchannels is it enables the use of very small volumes of samples and the reagents in microliter scales. And here is how we designed. So on the sensor chip, the CMOS sensor chip, we have, in this case, 4 channels. We have each channel with 300 microns in width and 300 microns in height, which can give you enough space for the reaction, but also miniaturized the usage of the sample and the reagent. And there are 4 channels on top, and there's a fluidic input and output on both sides, which is away from the sensing areas. And here's a picture shows how it looks like in real life. We use black epoxy in this case to fabricate the channels, because the black epoxy can further decrease the crosstalk effect. And here's just videos shows how the water introduced. From the left-hand side, that's just how it's introduced in 1 channel only, and on the right-hand channel, that's 16 channels. Actually, we have successfully fabricated 16 channels on top of the CMOS chip, and it can be increased further if we increase the size of the CMOS chip, because it's based on commercialized CMOS technology, so it can be easily increase the size of the CMOS chip so that we can do more experiment. But that's just for demonstration of the fluidics. But we have done actual measurement with 4 microfluidic channels. And for doing that, we need to functionalize the surface of the microfluidic channels for individual measurement. So in this case, we have 4 channels. In each of the channels, we're going to functionalize with the required enzymes and the reagent for individual measurement. So to print the required reagent and the enzymes into the individual channels, we use the printing technology called job on demand. So with equipment called Jet Lab 2. So it's a picoliter droplets of bioreagent can be printed into individual channels. So below that, that's just a demonstration of how small the droplet can be on a glass slide. And on the right-hand side, after we print all the required enzyme reagent into the microfluidic channels, we lymphocyze them for a further storage, or we call it freeze-dried as well. So which can increase the shelf life of the platform. So that's how it looks like on the microscope. So we freeze-dried all the required reagent and enzymes in the individual channels. The reagent can be confined in a solid state, which can increase the shelf life of the test. So, to start the measurement, you can just simply add your samples from inlet of the microfluidic channels. Then the reagent will goes into the sensing area by capillary force. So that's where the reaction is going to happen to generate protons or a color change, which can be detected in those channels. And also in each of the channels, there will be around 50 individual pixels to provide you enough space for the data analyze to increase the signal to noise ratio as well. And that's the technology. And as I said, it's quite a generic platform, right? It's based on different types of sensors, and with physical separations, it can be used for detect different types of like biomarkers. We heavily investigated on metabolites, but we also test proteins as well. So that's the target applications we have implanted as well. So for example, sepsis, home factor VIII testing, prostate cancer screening, acute kidney diseases, and also companion diagnosis and CVD diseases. So the idea is to, in the future, to have a cloud data analytics and specialized consultants and for online pharmacies, and it can be used for remote patient monitoring as well. So that's the future perspectives for this platform. It can be used remotely and for different applications. And here's one application we have target, which is the prostate cancer. So in the UK, about 1 in 8 men will get prostate cancer at some point in their lives. So, which is the most common cancer in men in the UK. And at the moment, there's no reliable screening program is available. So usually they offer like a one-off total PSA blood test at the moment, but it's not reliable enough because less than 1 in 3 men with elevated PSA will have prostate cancer, which means it will give the like very high false positive rate. And also at the same time, it missed about 15% of the cancers. So the idea of the platform is to increase the sensitivity and the specificity of the prostate cancer test. So here is the current clinical procedures for prostate cancer. As I said, like usually like they offer blood total PSA when the people have a symptoms onset. So that's where they have the blood total PSA test. After that, if you got a positive result, if the patient got positive result, there will be further examinations. For example, DRE and MRI and the biopsies. Those examinations requires very expensive and bulky machines, and also you need to wait for several months or years to have the examinations. And after you have that examinations, you can have a risk assessment based on all those tests to tell you if you're at high or intermediate or low risk of having a prostate cancer. So the idea of this platform, the Multicorder platform, is to get rid of all the unnecessary examinations. From just a multi-analyte blood test, we can have enough confidence to see that, to give the patient a risk assessment to tell them if they are at a high or low risk of having a prostate cancer. So that's the steps we were taking for the prostate cancer. Firstly, we identified more than 30 blood metabolites linked to the prostate cancer. Then we shortlist them by seeing which ones are available with our platforms. Then we discuss this with clinicians, cancer clinicians, to shortlist the metabolites can be used on our platform and which are the most useful metabolite biomarkers for prostate cancer. So last we defined a panel of 4 blood metabolites of interest for prostate cancer, which is glutamate, total concentration of L-type amino acids, choline, and cyclosin. That's the 4 metabolites we choose to perform on our platform. So as I said, based on the photodiode, which is the colorimetric biosensing method. So 4 metabolites are based on the same principle because we choose the correct enzymes to produce hydrogen peroxide for all of the 4 metabolites. So after that, we can produce a color change by using the correct colorimetric probes. So for all the 4 measurements, we use the same principle, which all gives a color change. So in that case, we can use photodiode for the simultaneous measurement. That after we choose the panels, we have done calibration curves with diluted serum. Then we moved to whole plasma. We validated compared with the gold standard method. Then we also moved to clinical trials as well. So we have used our platform to test 10 non-cancer samples and 16 prostate cancer samples. And that's the calibration curve, as I mentioned, in human plasma. So that's for 4 different metabolites, and they are all fits quite well with the mechanism maintain functions. And also for the low concentrations gives a linear response, which are good, and they are all in the physiological range. And we also test beyond the physiological range to prove that we can detect higher concentrations with a good sensitivity. And here are some statistics. So as I said, we checked the physiological range for 4 different metabolites, and they are all upregulated for prostate cancer. and that's the test range. They are all beyond the physiological range because this is they are all upregulated. So which means we want to detect higher concentrations. So that's why we go beyond the physiological range to have the detections. And the sample volume can be as low as like 25 microliters. The test time will be only 2 minutes because this is based on enzymatic reactions. We only care about the initial reaction rate. That's why we can have the test done within 2 minutes. So the limit detections and the nematode quantifications gives comparable result compared to the gold standard method as well, which means we have a similar performance compared to the gold standard method, but we can have more advantages by reducing the sample volumes, reduce the testing time, and also reduce the cost as well. So that's the clinical trial result for the 4 metabolites. You can see for the LAA, glutamate, and choline, that's in line with the result from literature because we got higher concentration of those metabolites within the prostate cancer samples, but not for the secretin. So after that, we choose to use only the first 3 metabolites for further analysis. And so we use the scatter plots for combination of relevant metabolites. For example, this is compare the glutamate with LAA result. So the intensities are normalized to the average of the populations. So the blue points will be the control samples and the red ones will be the cancel samples. So the scatter plots here shows there's a merit in using the metabolites all together compared to just use them individually. So, and also machine learning and the classification algorithm were also used to investigate the result to improve the sensitivity and the specificity. And here's the result. Here's the rough curves, shows you the result. So the metabolite intensities were used to train several classification models. We have tried different ones, and at the end, the random forest algorithm provides the best performance. And there are further investigations on the algorithm as well to further improve the performance. But at the moment, the random forest gives the best result. You can see here, if we compared with the gold standard method, which is the total PSA test. The total PSA test, as I mentioned, it has a low sensitivity. It's around 0.3, and specificity is okay. It's around 0.87. But with our platform, like the sensitivity can be increased to 0.94. With a slightly lower specificity, which is 0.7. So that means by using a combination of choosing metabolites, we can increase the sensitivity of the test for prostate cancer. And in the following test, we also combine the 2 methods. We have proved that we can detect both PSA and also the metabolites on our platform. By the combination of the 2 methods, we can increase on both sensitivities and the specificities. So that's one application. So another one is the bleeding disorders. So that's another application we have performed on the platform. So there are different types of bleeding disorders. We have focused on hemophilia and unknown disorders. So I'm going to discuss mainly on those 2 types. So that's the conventional diagnostic method currently for those bleeding disorders. For example, the complete blood counts and platelet aggregation test and bleeding time test. So that's very important technology for especially the hemophilia tests called the PT and the APTT. That's just measure the time of the clotting. Like there's a lot of manual steps involved for those 2 tests. It requires skilled operators for that and also experience to justify the result. And also, most recently, they use the chromogenic and fluorogenic method for those measurements as well, but it requires expensive and bulky machines. And that's why we are trying to modify all those assays to be used on our multicorder platforms to see if we can reduce the cost and simplify the process. So the first test we have been doing is called Factor VIII home testing, which is used for hemophilia patients, because there's like 1 in 5,000 men has hemophilia A diseases. So the hemophilia A diseases is like the patient will lack of Factor VIII, which is clotting factors called Factor VIII. So, and most of the care costs is from the factor replacement, because the patient will lack of the Factor VIII clotting factors. So the therapy will be just injecting replacement to help the patient to have enough Factor VIII in their bodies. And the hemophilia patient will help them to stop like bleeding unstoppably. So it's a high value emerging market at the moment. You can see here some numbers there to tell you how big the market is and how costly it is for the patient to do the treatment. And also not just that, the Factor VIII is currently poorly titrated, because only 75 patient, almost 75% patient will have the incorrect dose, because the replacement Factor VIII has been given like blindly. So the patient will be just inject a certain dose of Factor VIII replacement, but without knowing their current Factor VIII levels in their body. So there are risks for that, because if there's over medications, it's not just expensive, it can also cause thrombosis as well. So if we have a Factor VIII home testing device, it can reduce the cost and improve the outcome as well. So here's the one common method, as I mentioned before, it's called chromogenic assay. Here is how the principle of it works. We don't need to worry about the details. All we need to know is it produced a color change at the end, which can be used, can be detected by our photodiode sensors. So depends on the series, depends on the Factor VIII levels. It can be classified as severe patient and moderate and mild. So for the severe patient, hemophilia patient, they will have less than 1% of Factor VIII levels compared to the normal people. And it will be between 1 and 5% for moderate and between 5 and 40 for mild. So usually if you have above 1%, you can still live normally, but with dangers. But if you are severe hemophilia A patient, it will be very dangerous. So the patient need to inject Factor VIII replacement regularly, usually like 3 times a week without known concentrations. So that's why we need the monitoring devices to tell the patient how much Factor VIII levels they have currently. In that case, they can give the correct dose of the replacement to help them to maintain the Factor VIII levels above 1 or above 5. So here's in figure A, that's a conventional method for the Factor VIII measurement. You can see there are like 6-7 steps involved, and there are also incubation steps involved for the conventional method. And also you need to add the samples at the very beginning, so which is not ideal for point of care tests, because for most of the point of care devices, we want patient or the end users to just add the samples. That's how we modify the assays based on the conventional method to our multicorder platforms. We call it one-step approach, because for this measurement, there's only one step involved, which is add the sample. In this case, it's plasma samples. Then you just do the detections with the platform. So we modify the steps, and also the result can be detected by our optical sensors. In this case, is the photodiode. And on the right-hand side, that just shows a picture of different concentrations of Factor VIII, gives you a color change. Here's the result. So A and B shows a conventional methods result, and C and D shows the result from the one-step approach on the multicorder platform. it gives the comparable result, and the reactions can happen in a few minutes. So, which proves that our platform can perform the same measurement compared to the conventional method, but with much easier operations and with less usage of the volumes of the reagent and samples. And here's a table shows a comparison between the conventional method with our multicorder one-step approach. And for the time, so just for detections for the conventional method, it usually takes above 20 minutes. That's without the preparation. But for the multicorder, we can do everything within 5 minutes, and we don't need incubation in betweens, which means we can operate everything at room temperature. And the volumes, we have reduced the volumes to around 50 microliters, and also the detection range for the multicorder will be around 0.5 to 20%. So although like the detection range for the conventional method is bigger, but that's from the diluted plasma. So the diluted plasma so that they can detect higher concentrations. But in our measurement, we didn't do any process preparation on the sample.
Tomorrow, because I need my home is lessons are expired, so I need to move my room to a new room, so I won't be here off.
Sorry, can you repeat the question? Hello?
I think it's Tamara. I don't know if he was asking a question or forgot to mute the microphone.
Yeah.
Okay, I'll just continue. We can.
Yeah.
I can explain the question at the end.
Yeah.
Thanks. So, and also as I mentioned, for the most of the severe hemophilia patients, they only need to maintain their factor VIII levels above 1 and above 5%. So that's the range is enough to cover that. And also we use the whole blood plasma in this case. And we have comparable nematode detections for both methods. And beyond that, so we also performed the thrombin generation assay. That was for the unknown bleeding disorders. As I mentioned in the beginning, we focused on the hemophilia and unknown bleeding disorders. So here's another assay for unknown bleeding disorders. So thrombin generation assay, or TGA, is a global assay that can provide overall assessment of hemostatus. You can see from the left-hand side, the thrombin is the end product from the coagulation process. So it can provide more information to give a general overall assessment of the hemostatus process. And for this assay, we also use the chromogenic approach, which can produce a color change, which can be detected by our photodiode. So the reason we want to have an assay for unknown bleeding disorders is because recent studies shows that only 30% of the patient referred to for assessment can be diagnosed with mild bleeding disorders like with brain disease or platelet function defect. So the majority of those patients can only be diagnosed with unknown disorders. So, but we still need to know the reason for that and also how we are going to treat it, because most of the patient is going to have like surgical procedures or a childbirth when they do this measurement. So thrombin generation assay will be dynamically measured to give overall assessment on the conditions of the patient. Commercial methods currently for the thrombin generation assay. So that's from 3 big companies, 2 based on fluorogenic assays from Technoclone and Stego. So, but the scan time will be around 1 to 2 hours for those 2 methods. So there's another method from Simmons Healthcare, which is based on chromogenic assay. So it can give you a result within 20 minutes. So that's also why we choose this method to be modified on our platform. So What makes thrombin generation assay such a useful tool is it generates so-called thrombin generation curve. From the left-hand side, it can provide a lot of information, important information about coagulation process. For example, it gives you the lag time and also the endogenous thrombin potentials, so which tells you the amount of thrombin generated, and also the peak. It can gives you a lot of information about your coagulation process status at the moment. So that's a comparison between the example thrombin generation curve and the one from our platform. You can see it gives the similar result from our platform, gives you information about lag time and also the total thrombin generated during the process and also the peak time as well. So, and here just a figure shows, because we're trying to demonstrate if we can detect with different concentrations of factor VIII inside the human plasma, and that's a result. It can give you a differentiation between different concentrations of factor VIII inside the human plasma, and it can give you a good thrombin generation curve to be analyzed for further examinations, can provide useful information for the clinicians to decide which will be the next step for the, for example, the surgery operation or the childbirth. And that's the two applications. And if you remember, I mentioned this is a generic platform, which means we can detect a lot of different biomarkers. So here are some, the list shows the metabolites and proteins that has been demonstrated so far based on ISFET and photodiodes. And also we have proof that some of those biomarkers has clinical relevance, like, for example, the glutamate, L-amylase acid, and all those biomarkers has clinical relevance. And also we have proved that those metabolites can give you good sensitivity to be used for detecting those for decision makers. We also, because I mentioned the multiplexing, so we have demonstrated there are different assays by detecting different biomarkers at the same time. Currently, they are all based on photodiode because the photodiode is very straightforward and quite reliable, can be used for disposable purposes as well. So that's why we focus on photodiode mainly at the moment. And here are some publications. If you are interested, you can take a look later on. And at the end, I'm talking about the group I'm in at the moment. It's called Microsystem Technology here, based in University of Glasgow. So the group is funded by several major grants, for example, from EPRSRC, from Innovate UK, and deliver research mainly on medical sensors systems and also CMOS integrated circuits and biosensors. We have other applications like image technologies for visible and mid-infrared and terahertz applications, and nanotechnologies, photonics, and also metamaterials and surface plasma resonances. So that's all the applications we have at the moment. And if you are interested, please contact us. So at the moment, we have 3 principal investigators in the group, Professor David Cumming, myself, and Dr. Vincenzo Pacino. So if you're interested, please contact us. That's all for today's presentation. Thank you very much.